This video is part of our Fundamentals of Nursing Studies series. Today we'll discuss the nursing process. One of the first things you will learn in nursing school is the nursing process. The nursing process is a key, fundamental concept that passes through every single thing you will do and learn in nursing school. So, as a nursing student, you must know what it is, how it works, and why it matters. The nursing process can be remembered by an acronym, ADPIE, corresponding to each stage. A equals assessment, D equals diagnose, P equals plan, I's implement, and E equals evaluate. Assessment. Assessment is the first stage of the nursing process. In this stage, you assess the patient and gather data. This data can be objective from your assessment or subjective based on what the patient tells you. Assessment data can be obtained in a variety of ways. The main methods used to collect data are observation, health interviews, and physical examination. Diagnosis. Diagnosis is the second stage in the nursing process. A nursing diagnosis has statements about a client's potential or actual health problem. The nurse uses the assessment information to identify the client's actual and potential problems and strengths. Let's discuss what an actual problem versus a potential problem is. The actual problems are those that come directly out of the assessment. For example, the client's pain from a leg fracture is an actual problem. On the other hand, potential problems could arise from the actual problem. For example, a client with a leg fracture is at risk of developing a pressure injury if confined to a bed. Let's pause here. A nursing diagnosis is not the same as a medical diagnosis, so do not confuse them. A nurse initiates a nursing diagnosis and describes a response to the medical diagnosis. A medical diagnosis is given by a doctor to a client to define a medical condition or disease or injury. Planning or care planning. Planning starts with the first client contact and continues until the nurse-client relationship ends, usually at discharge. The planning stage provides direction for nursing interventions. The planning stage is where interventions are identified to reduce, resolve, or prevent the client's problems while supporting the patient's strengths in an organized, goal-directed way. Goals need to be set, both short-term and long-term. Goals and outcomes are formed based on evidence-based guidelines. Goals should be SMART, which are specific, measurable, achievable, realistic, and timely. There are different types of planning. The most common are: initial planning is usually done by the nurse that does the initial or admission assessment. Ongoing planning is done by all nurses caring for the client. As new information becomes available and the client's response to interventions is evaluated, the initial care plan can be further individualized to the client. The ongoing care plan also sets priorities for the client during the shift. Discharge planning starts for all clients when they are admitted to any healthcare setting. Discharge planning anticipates and plans for client needs after discharge. The nurse will also prepare for any necessary patient and family education and instructions before discharge. Implement. In this stage of the nursing process, you put your plan into action. This is when you do your actual nursing interventions as outlined in the care plan. Interventions should be specific to each client and focus on achievable outcomes. As each new member of the caring team comes on duty, they need to reassess if the care being delivered is still appropriate. Has anything new developed to change the plan of care? How is the patient responding to the care provided? Ongoing assessment of the patient is vital in the implementation stage. Evaluate. In this stage, the nurse will evaluate how your client is doing after the interventions are performed. After the assessment, the most essential part of the nursing process is evaluating whether the care achieved the desired result. Evaluation should not just occur at the end of a course of treatment or care, but should constantly occur as care is implemented. This brings us to the end of our lesson on the nursing process. Now that you understand the basics of the nursing process, you should be able to start applying it in clinical and when going through case studies or taking exams. We will see you in the next class on our Fundamentals of Nursing Studies series. Thank you.